I do want to thank everyone for coming. I really appreciate, we have a great community, a huge support system, and I'm really happy about that. I'm Holly Wolf, the Director of Marketing and Foundation here. I'm going to tell you a little bit about Dr. Sonnenberg, who's going to be doing the presentation. Dr. Sonnenberg graduated from Allegheny College in 1976 with a BS in chemistry in the University of Pittsburgh School of Medicine in 1980. He finished his residency in family medicine at McKeesborough Hospital in 1983. He has been in private practice in this Titusville area since 1983. He is past president of the Pennsylvania of Family Physicians, the largest specialty organization in the state, with over 5,000 physician members. He has been the featured speaker at dozens of state and national meetings. He is scheduled to speak in San Antonio, Texas in September, so pretty soon, at the FMX meeting. It's the largest annual gathering of family physicians in the world. He is one of 25 speakers to be selected out of 300, so that's a great honor for us to have such a wonderful physician in our community. And these will be recorded for online distribution. This will be the 10th time he's been invited to speak at this annual event. His lectures have been recorded and published numerous times on FP Audio and Audio Digest, providing continuing educations for thousands of physicians. Recently, he has been appointed to Assistant Clinical Professor of Community Medicine for Penn State University, School of Medicine, and Hershey. So give him a round of applause.
Thank you very much. Thank you. I think Lyme disease probably represents a really fascinating story, and I'm going to set it up sequentially. Today's story involves what I'm going to say are heroes of this disease, scoundrels of this disease, get into the signs of this disease, solutions, how we can treat it, how we can prevent it, and the lessons we can learn from Lyme disease. First off, I want to set up a hero. This guy is Alan Steer. He was a talented violinist. He actually trained under Itzhak Perlman. He had a wonderful career coming, but he actually developed a tremor in his finger that made him unable to play the violin. So thus he gave it up, went into the next best thing, medicine, and became an infectious disease expert. Later on, in the 1970s, there was a lady named Polly Murray. She was in Lyme, Connecticut. Her family was racked with illness. Several of her children had these multitude of symptoms. Children all over the area seemed to be developing arthritic symptoms. And they were all being told that they had juvenile rheumatoid arthritis. She didn't think that was right. So what she did is she brought in Alan Steer. At the time, he was 32 years old. He was an infectious disease fellow at Yale University. He listened, he listened, he listened. He traced this disease. He spent several years studying it, and he came to the conclusion that this is tick-borne. It's either a virus, it's either a bacteria, but it's spread, and that's what it is. This guy listened to the patients. He discovered a new disease at the tender age of 33. So what happened? A few years later, a guy named Bergdorfia actually found the disease. It is a bacteria. It's a kind of a pretty looking thing. It looks like a corkscrew that you use to open up a wine container. But then later on, years later, he suddenly was faced with these patients that were being referred to him that had really dubious symptoms, just being confused, just feeling weak and stuff like that, having no blood tests to support it being said it's Lyme disease. He became a villain because in the meantime, there had been developed this cadre of physicians who made a career out of diagnosing almost everything as Lyme disease. Thus, whenever this guy who discovered the disease goes to a conference, he has to be surrounded by bodyguards. There has to be bomb squads checking their package, and the official proclamation is Steer has been scheduled for termination. This is the discovery. This story also has scoundrels, a case of medicine that has gone amok, really gone amok. Okay, here's a case that actually happened. This is from the Mayo Clinic, a female. She had knee pain since childhood. She had camped once in her life. No history at all of a tick bite, at all. Her history included she had a gallbladder out, she got occasional headaches, every once in a while she complained of mental fogginess, she had transient numbness. Symptoms that any of us could have at any time. She had a periodic rash. She consulted in 1996 one of these Lyme experts to do it. Tests were run. 6 tests were run for Lyme disease, all negative. 7 Western blot tests run for Lyme disease, all negative. PCR testing of the blood, of the urine, of the spinal fluid, all negative. In spite of this, she was declared to have Lyme disease by this Lyme expert. So what happened? Well, she was initially placed on an antibiotic called doxycycline. She still had weakness and stuff like that. It was later changed to another antibiotic, clarithromycin. Then minocycline. By the way, minocycline, if you use it too long, will make your skin blue. She had a catheter placed in him. She received ceftriaxone, 4 milligrams IV every 8 hours. That is a whopping high dose. When that didn't work, doxycycline IV was later added. This antibiotic regimen continued for 27 months. 27 months she had that catheter in her. So anyways, what happened for 8 months, she started losing weight. She lost 50 pounds of weight. She developed twitching in her extremities. She was confused. Her liver was large. She was jaundiced. This lady was sick. She spent a month in the ICU at a cost of $400,000. Her bloodstream, her heart, was just filled with fungus. She died after a month of treatment. And what happened? She had a large clot that was just filled with this fungus. It filled the heart. There was fungus all throughout her lung. She had blockage of the left main pulmonary artery from this fungus. Autopsy, there was not a single finding of Lyme disease. Not a single finding of Lyme disease. I ran into a case myself. This lady came up to me after one of these lectures and said, yeah, I had this joint pain 2 years ago. It cleared up after a month, but they told me I had Lyme disease. So she was on 2 powerful antibiotics for 2 years. Whenever she felt a little weak, she'd get put on an antibiotic. None of the blood tests showed Lyme disease. What did she really have? Well, it turned out when you ask a little more questions, she had, her children 2 years ago had a rash. Slap cheek appearance. Her children had fifth disease. When a child gets fifth disease, they get a rash on their cheeks. When an adult gets fifth disease, they get an arthritis that for the world looks like rheumatoid arthritis, except it clears up on its own in a few months. This was never Lyme disease. This was a post-viral arthritis that occurred and was self-limited. There was no need for those 2 years of antibiotics. So what sort of people are we looking at? This guy is the head of the Lyme Foundation. What is his career? What is his CV? Well, he's kicked out of the University of California in San Francisco for falsifying data on an AIDS study. He became associate director of a penis enlargement clinic for 2 years. That failed. I don't know if the results were good enough. But he became president of the International Lyme Society. That's the sort of guy we're looking at. What are the claims these people make? That this disease affects 18 million people in this country and we aren't recognizing it. 50% of all chronic illnesses claimed by these people are from Lyme disease. They claim it's sexually transmitted. There's no basis for that. It's transmitted to kids and causes birth defects. There's no evidence for that. And there's household transmission. There's no evidence for that. But they make good business of it. There are doctors in Pennsylvania who make big business of it. There is a big increase in Lyme disease in the last few weeks. I've noticed that a lot. I've gone years without diagnosing a case of Lyme disease. In the last week, I've diagnosed 3. There seems to be something going on. It's coming big. So what does my treatment involve? I see them for 1 office visit. I get the test. I put them on an antibiotic. I follow up once. No big expense. No big expense. The antibiotic I use is relatively reasonably priced. What do these people do? You never get over it. It's a chronic disease. It's sneaky. They put them on an antibiotics IV that costs up to $800 a day. That's expensive. My patients are having good results. They feel good in 2 days. I think there's a sort of a scam going on here. So what are the signs that these people look for Lyme disease? Fatigue, memory loss, burning, stabbing pain, tremors, joint pain, shortness of breath, poor coordination, anxiety, slurred speech, swollen glands. If I get anxious, I'll get slurred speech. Chills, fever, vomiting, rash, muscle cramps, sudden mood changes, headaches, myalgias, poor concentration, light sensitivity, unusual depression, and ringing in the ears. Is there anyone in this room who hasn't had one of these symptoms? You all have Lyme disease, and you don't even need testing if you have one of these symptoms. Associated disease. What diseases are we have that us doctors make the silly diagnosis and really is Lyme disease? ALS, polymyalgia rheumatica, Bell's palsy, rheumatoid arthritis, chronic fatigue, scleroderma, multiple sclerosis, irritable bowel, Parkinson's disease, depression, middle ear pain, vertigo, rheumatoid arthritis. We are screwing up. We are messing up. This is really Lyme disease. No, I don't think so. Anyways, what is inappropriate treatment? They've given them injections of bismuth, bee venom, deliberately inoculate the patients with malaria. And I'll get into that. They give them simultaneous or sequential antibiotics for months and years. Malaria. This Lyme disease is closely akin to syphilis. If you look at them under the microscope, they look kind of the same. They have this corkscrew appearance. Back in the old days, before they had penicillin, one of the ways they treated syphilis was to make the patient really, really hot. If you make a really hot fever, the spirochete doesn't do well, it dies. So what they used to do in the old days, before antibiotics, was deliberately give these patients malaria. Well, someone says, well, maybe we can do it now. Maybe, penicillin is too expensive or something like that. We'll make the patient sick with malaria. That has been done. Silver. Okay, this is funny. This politician, right-winger, end of the world, is convinced that someday there will be no antibiotics left when civilization comes to the end and zombies take over. So what he did is he loaded himself up with silver because silver fights all bacteria. The guy turned blue. Anyways, silver has been used as a treatment for Lyme disease. The disease, the syndrome they get is called aguirre, which is blue skin. What's other treatment? They use hyperbaric oxygen, put them in super strong oxygen. It's supposed to stimulate the immunity. There is no evidence that this works. So who are the cast of characters in Lyme disease? Who are we dealing with? Well, first off, we have the bacteria. If you look at it, it does have a kind of corkscrew appearance. That looks for the world like syphilis, and it is closely related to syphilis. This is not a sophisticated bacteria. There's only a few genes on it, mostly genes that deal with the surface of the bacteria. There's very few genes that deal with metabolism. This bacteria does not have much of metabolism. It doesn't do much. It doesn't secrete any toxins. More importantly, there are no genes in it that create resistance. There are no genes in this that create resistance to antibiotics. Antibiotics will continue to work. This bacteria is slow growing. It doubles every 12 hours. Compare this to staph and strep. Strep doubles every 20 minutes. It grows fiercely. This grows slowly. So the evidence, sometimes it takes a long time for the blood test to turn positive because it's a slow growing bacteria. And also you got to give antibiotics a little longer because you got to catch the bacteria at its vulnerable state. So you got to give a longer course of an antibiotic with this disease. The whitefoot mouse. I've read lately that last year was a banner year for the whitefoot mouse. That's important because on the following year, there's going to be a lot of Lyme disease if the whitefoot mouse is prevalent. This is the primary reservoir for Lyme disease and the ticks, basically the larva and the nymph stage. Up to 90% of these mice may be affected with Lyme disease. And the strange thing about this mouse is that the tick doesn't bother them. I think this mouse thinks that ticks are mouse bling. Up to 100 ticks may be on a mouse. It doesn't bother them. It may be on their nose. It may be on their body. They just wear it. It doesn't bother them. They get sick. They just seem to love it. Unlike other animals who try to get rid of the ticks bother it. It doesn't bother the mouse at all. So then we have the white-tailed deer. White-tailed deer is an edge species. They like to live on the borders between fields and forests. This is startling. There are 10 times more deer in this country than when Columbus came there. There are more deer. One reason why is there more Lyme disease? There's more deer. Simple reason. Why has this happened? There's nothing left to eat the deers. There's only guns and cars. And I've done my part with cars. They are very fertile. I'm rooting for the hunters. Look at this graph. Look at how, since 1880, how the deer population has markedly increased in the United States. This has gone up. This is one of the reasons why Lyme disease is so prevalent. So here's the family photo. We start off with the larva, the nymph, the adult male, and the adult female. The adult female is much, much bigger. So what's the life cycle? Well, it kind of starts out like this. Let me kind of draw it. You have this female right here, who lays the eggs. The larva emerges in the first year. Then it affects a small animal, usually the white-tailed mouse. And it spends its time there. It takes one meal, and it molts. So it goes through the winter. They lie dormant. Then they come out in the nymph stage, and they affect other mammals, dogs, anything like that, or the white-tailed deer. And they take their second meal. The female gets engorged, and they lay the egg. So you can see if there's a lot of involvement with the white-tailed mouse a year before, the following year, there's going to be a lot of Lyme disease. And I really think personally, and I think the lab people said this, they're seeing a lot of positive tests. This year is going to be a big year. So seasonal activity, when are you most likely to get it? In the summer when people are outside. You don't get Lyme disease in the winter. People are inside. Geographic distribution, you can see probably the northeast coast is probably the biggest. We're kind of intermediate. But Lyme disease has been described in every single state in the Union. Here's the engorged female after she takes a blood meal. She latches on, she takes her meal, she literally increases in size 100-fold. Then she lays her eggs. Look at those eggs. So anyways, what do? Well, the ticks do not fly, they don't jump, they don't drop. You rub up against them and they attach to the skin. They cut into the skin. Look at that little thing. That can slice right into the skin. It excretes a cement and it holds tightly into the skin. During that period of time, during the feeding, it increases in size 100-fold. It takes its blood meal. It takes at least 24 hours to feed. That's important, 24 hours. What happens is it feeds, it gets 100-fold, and it regurgitates a little bit of blood back. That's when the person gets infected. Not when it attaches, but when it regurgitates. And usually that occurs in about 24 to 48 hours. So the chance, if the tick is on you for a few hours and you pull it out, you probably aren't going to get Lyme disease. It's probably pretty low. It's got to be in 24, 48 hours for you to get a reasonable test. And you can see how your chances of getting Lyme disease go up from 1 day to 2 days to 3 days. The chance goes up. So anyways, again, why are we seeing more of it? There's more ticks out there. The deer is overpopulated, 10 times more deer now than back in our primal world. There's increase in disease recognition. There is some evidence, they've actually found Lyme disease in mummified remains of humans that have been in this country 6,000 years ago. It's always been there. It's been in Europe, but we finally found it, thanks to Alan Steer. So we know how to spot it. We love having homes in wooded areas. That's partially to explain the fault, and there's more outside contact. So the clinical manifestations, what do you notice? Well, there's 3 stages of Lyme disease. There's the early localized form, the rash, early disseminated one when you start seeing systemic symptoms, and the late findings. So the early localized one. The early localized one is the classic target rash, erythema chronica migrans. During this period of time of the rash, you may have fever, joint pain, you feel sick like you have the flu, you may have an eye infection, you may have a stiff neck. Not everyone gets the rash. But when you see the rash, this is pathognomonic. That is a fancy term. If you see the rash, this is Lyme disease. There is nothing else. This is good enough for the diagnosis. Should you get a blood test? No. The blood test is worthless at this stage. It takes 1 month for the disease to show up as an antibody response in the blood. 1 month. Because it's slow growing. The body is slow to develop antibodies. Don't get a blood test. It will only confuse you. Treat this when you see the rash. But not everybody gets the rash. So it's, like I said, it's pathognomonic. You see it in most people who get infected. It's generally painless, and it expands slowly. It may develop 3 days after the rash, usually 3 days after the bite, sometimes 7 to 10 days after the bite. But it's not always typical. This was the rash of Lyme disease. This looks nothing like a target. Who knows? Someone may blame this on the detergent change. It can have blisters. This can be Lyme disease. The facial rash. Now, you may not spot this right away, but if you see there's a suggestion of a target-like lesion, a ring, but it's covered with hair. So therefore, that can be sneaky. So then you go to the next stage. If it's not treated, if there's no rash or the rash isn't spotted, it occurs some embarrassing place where you can't see it, it goes on to the next stage. So the next stage is you develop more muscle pain, more joint pain, you develop palpitations, sometimes irregularity of the heartbeats occur, or neurologic problems. It can affect the nervous system. So what do you see? The acute neurologic things is Bell's palsy. Bell's palsy can be caused by Lyme disease, and especially in younger people. If someone has Bell's palsy under the age of 35, there's about a 1/3 chance that this is caused by Lyme disease. So I think it's reasonable to check maybe everyone who has Bell's palsy with Lyme disease. You get radicular neuronitis, which means just the back plane hurts all over, the muscles hurt, and you can have a mild encephalitis, some cognitive clouding. You just don't remember things. There's some memory loss, sleep problems, and changes in mood. So the radicular neuronitis, it's painful, the back hurts, it may interfere with sleep, you feel tingling, numbness, burning of the back, and it can affect the limbs. Things are just plain sore. So finally, the last stage. If it isn't picked up, then you have the persistent late stage. And it can affect the heart, it can affect the brain, the nerves, or the joints. Carditis, it can affect the heart. It can affect all layers of the heart, but predominantly this affects the heart muscle. It doesn't affect the coronaries. It doesn't really affect the coronaries. It doesn't affect the heart valves. It affects the heart muscles. And it can occur shortly after the bite, 4 days or 7 months. It's more likely to occur in males. It occurs later in the summer, into the fall. This is interesting. The heart people seem to have less of a chance of having that rash. They have less than a half a chance of having the rash compared to 70 to 80% of normal patients. They're less likely to have the rash. So what are the symptoms? Lightheadedness, fainting, shortness of breath, palpitations, and chest pain. There have been deaths from the carditis of Lyme disease. This was recently reported by the CDC. 3 patients, 1 woman, 2 males, all of in the northeast part of the country. They basically had a sudden collapse, and none of those 3 that died had the rash. So what does happen? It more affects the electrical system, how the heart functions in an organized manner electrically. So they can have a first-degree block, which isn't so bad, second-degree block, which is kind of bad, and if you haven't guessed already, a third-degree block is bad. There's total disorganization between the top part of the heart and the lower part of the heart. You can have palpitations, you can pass out, chest pain, shortness of breath. Antibiotics work well. They'll reverse these blocks, but sometimes they require a temporary pacemaker because the heart isn't functioning quite well until the antibiotics kick in. So then it involves the central nervous system, Lyme disease. So what you can see is you can see cognitive impairment, mental clouding, leg weakness, awkward gait. The first case I ever picked up with Lyme disease was a boy who had an awkward gait, who was just stumbling, who was falling over. That was Lyme disease. A facial palsy, Bell's palsy, a paralysis of the face, bladder problems, vertigo, or back pain. You can have psychiatric symptoms. You can actually develop frank psychosis, panic, anxiety, and they describe the personalization. You just don't seem to be with yourself, the personalization. So then it can involve the peripheral nervous system. Like I said before, the radicular neuronitis, the Bell's palsy, up to 10% of patients. It's more common to be a cause of Bell's palsy in the younger patients. The Bell's palsy may predate positive serology. It may not show up on the blood test. So anyways, Lyme and the joints. If the patient is untreated, there's a 60% chance that the Lyme disease will advance and cause pain in the joints. This may occur weeks to years after the infection. These people have a delightfully high titer on blood test. It really shows up on blood test when you have the joint pain. It usually involves larger joints, particularly the knee, but can involve the TMJ joint. So you have arthritis of the knee, you have mild to moderate pain, Baker's cyst may be formed, you may develop erosions. This is kind of cool. Lyme disease has even been found in an artificial synthetic joint. That's kind of neat. So the diagnosis, how do we make it? Well, we got to look at the clinical picture. Does it make sense? Did they have the right exposure? Was there a tick bite? Do they go outside? Is there a history of exposure? Are they in the right part of the country where it's fairly common? And do they have a positive blood test? So you do the antibody response. Like I said, this is a slow-growing bacteria. It doesn't multiply fast. So it takes a while for the blood test to turn positive. An IgM, which is a type of antibody that shows up first in infection, shows up at 2 to 4 weeks. The IgG, which is a more longer-term antibody, shows up a little later. The IgM tends to decline. After about a half a year, the IgG persists. So there's a two-step process. When you go to the lab and get the Lyme titer, there's a two-step process. The first thing they do is an ELISA test. ELISA test is good at picking up almost anything. It has a high sensitivity. It picks up everything. Trouble is it picks up too many things. So sometimes it picks up things that are sort of like Lyme disease, but really aren't Lyme disease. So you got to go to the second test, the Western blot. This is specific for it. So you need the two-stage testing. You can't go on just one stage. So anyways, I'll kind of jump past this one. You can get false positive tests, particularly with the initial ELISA test. Because if you have syphilis, a lot like Lyme disease, it may show up like Lyme disease. There are other forms of spirochetes in the body, and particularly around the teeth. So if you have bad teeth, it may look like Lyme disease. There's a disease called relapsing fever, rheumatoid arthritis, and infectious mononucleosis can give a test that sort of looks like Lyme disease. So that's why you need the Western blot test. It's specific. It hones in on it. So lastly, how do we prevent Lyme disease? How do you stop it from happening? This is oops. See, I get upset. This is another story. I was going pretty smooth there, wasn't I? So anyways, this is the vaccination. There was a vaccine for this disease. And this vaccine first came out in 1998. As soon as the vaccine hit the market, the Lyme literate physicians jumped on it. They grabbed patients. They had patients testifying in front of Congress that this disease was bad. This vaccine was bad. So what happened is finally the manufacturer had to take it off the market because they thought it was bad. This vaccine is kind of interesting. Oh my word. Okay. This disease is kind of interesting. What it does is it creates antibodies. It doesn't work in the person. It works in the tick. So the tick sucks the blood out. It sucks the vaccine, the antibodies that the body makes. It kills the Lyme disease within the tick. When the tick vomits the blood back into you, it's totally non-infectious. The vaccine worked pretty well. What's the trouble is, number one, insurance companies didn't seem to cover it. Number two, it wasn't quite perfect. It was pretty good, but it wasn't quite perfect. But more importantly, it was hounded off the market by the Lyme literate physicians. It was hounded off the market by the lawyers who claimed that they had patients who developed autoimmune diseases because of this vaccine. There was no evidence that this vaccine did any of it. And the last thing the Lyme literate physicians want is no Lyme disease. They love Lyme disease. They make a lot of money from it. So as a result, there is a very effective Lyme vaccine for your dog. There's no vaccine out there for humans. So people have actually gone to veterinarians and begged them to give them the vaccine. They can't get it. This is a quote. I believe it's from Alan Steer. Lyme disease is the only infection I know of where we have a safe, effective vaccine, but it's not available to the public. Now, I understand, late breaking news, there is a vaccine being fast-tracked. I hope the hell this vaccine gets the respect it deserves, because we need to do something to prevent this disease. So anyways, another way you can do it is tick checks. If you get the ticks out soon, you won't get Lyme disease. If you get it out under 24 hours, you probably won't get Lyme disease. 2 studies have showed a benefit of early tick removal. So again, I go back to the chance of transmission. The longer the tick is, the more likely you are to get the disease. If it's under 24 hours, it's pretty low. So, improper tick removal. Sharp forceps crushing the tick before you take it out, squeezing it, petroleum jelly, gasoline, lidocaine, match, hot nail. Don't do it twisting, jerking bare hands. The proper removal is using a set of tweezers and pulling it out. What if you get a tick bite that's been in over 24 hours and you're worried about it? There is a study in JAMA that showed the value of prophylaxis. A single dose, 2 capsules of doxycycline taken are 87% effective in preventing the rash of Lyme disease, thus preventing Lyme disease. The number needed to treat is 12. If you treat 12 people, you're going to prevent 1 case of Lyme disease. It's pretty good prophylaxis, and it's pretty simple. So what you can do, there are sprays that you can spray in your yard that actually kill the ticks. Clothing, wear light colored clothing so you can see the tick. Tuck your pants into the socks. That's a really snazzy look, isn't it? Don't wear open-toe shoes. Don't wear sandals. Ticks cannot survive in a dryer for an hour. DEET at 30 to 40% is the most effective. Apply to the clothes. It generally will not harm the material. Landscape management. 82% of the ticks that we run into are within 3 yards, 10 feet of the border. That's where you got to manage the ticks, at the border. Keep the lawn mowed, remove leaf, brush, and weeds at the edge of the lawn. Keep the areas open to the sun. Ticks don't like sun. There's the before and after picture. The after picture down below is what the yard should look like to help prevent ticks. So playground areas, that's a bad playground area. This is a good playground area. Good exposure to the sun. Ticks can't survive there. And deer control. We have 60 deer per square mile. I've killed 3 of them personally. I need other people's helps out there. Deer-resistant planting, fencing, and controlled hunting. And finally, we got to be cautious. We got to listen to the wisdom of Abraham Lincoln. Don't believe everything you read on the internet just because there's a picture with a quote on it. That is a quote from Abe Lincoln. Okay, thank you. Any questions or discussions?
You know, I've been hunting deer for probably 40 years.
Yeah?
And I can recall back about, say, 30, 40 years ago, when I first started, it was not uncommon to see 75 deer in a day, first day of deer hunting. Now, some could have been one and the same.
Yeah.
However, I hunted this particular area out by Neiltown, and I've got quite a few deer there. I went back out there a few years ago, maybe 10 years ago. I only saw 5 deer. And 30 or 40 years ago, I would see 75 or more. Now, it's hard for me to believe that deer population is great, because I don't see them.
Well, you're noticing a local phenomenon. Maybe there's something happening to your area that's doing that. But I'm talking about population studies from large areas are showing more deer.
Okay.
And I know forestry people are actually talking about how the excess deer have changed the nature of an untouched forest. They get the stuff underneath. We don't see the brush in the forest that we used to. So it's actually changed the forest too. There are more deer out there. I guess you got to look harder. Yeah?
Back in '88, I had that bullseye rash. This is exactly what they showed the picture. And back then the doctor did the test in the hospital back in '88. spider bit you or something else, but it was when it ticked.
Yeah.
And it lay dormant in the body for since 88, and then show up again now.
I think 88 is a tad long. I would believe 10 to 20 years, but you're almost talking about 30 years here. If you thought this was a typical, my recommendation is probably get the blood test. But the fact that the blood test was negative with the rash doesn't deter me at all. The rash shows up before the blood test is positive. So I would, there are certain times when you don't want to get a test, when I don't want to know the results, when I plug my ears in, I don't want to listen to the test, I know this is Lyme disease, I'll treat it. When you see the rash, don't get the blood test, it will only mislead you.
Also, 3 months ago, I had a test done because I was feeling weak all over, whole body stuff. I couldn't move, get out of bed. So I got changed on. I changed the coffee. I've been drinking decaf coffee then, and taking a pill for glycosamine for joints.
Yeah.
Because I had arthritis supposedly in the knee. And anyways, that one, it didn't change it. And so I had a doctor test me. This was back in March. And April, then I had a test done, blood test. And they did that, one of them,
Yeah.
2 different tests.
Yeah, the lies in the western
Both
blot.
come back negative, real long sentence, a lot of bacteria is mentioned. The very last sentence, it could be early stages, could be a false negative. So there
Well, if they put a false negative, that's the lab covering their own butt. Yeah.
But it hasn't gotten any
You know,
better.
if the lab messes up, they say, well, we told you we may miss it. The lawyer told them to put that line in.
But that was back in
Yeah.
April, May, first part of May. And it's still the same, I was getting worse, but it's almost immobile after about 3 or 4 days.
Yeah, the trouble is, after 30 years, real arthritis may kick in too.
Correct, it's
Yeah.
all over the whole body.
Yeah.
More muscle than arthritis. It's all muscle. And
That's almost the case where I'd be tempted. There's another test that I didn't mention because it's a little fancy called the PR. Well, I alluded to it briefly. A PCR test. If there's a particularly bad joint, get a joint aspirate and do a PCR testing in it to see if there's active. Yeah. Well, it's a test where they actually use genetics to amplify the amount. If there's a little bit of Lyme disease in there, they take it out and they use genetics to amplify it to make a bigger result so it shows up in a real test. That's PCR. I mean, if you really want to pursue it, that's what I'd probably do. No further blood tests. Go for the worst joint and get the fluid. Yeah? We'll bounce.
I got something.
Yeah.
2 years ago, I took my grandson hunting there in October for deer. And the next day, so we're after 24 hours, I put my glasses on. I thought, boy, that hurts. Well, I looked and I had a tick. And yeah. So I freaked out and made him take it out. And the next day I went to see the doctor and he made sure everything was out of there. So the following summer, I was having these symptoms that you have, and they did a blood test, came back negative.
Okay.
So I have those symptoms that you talk about. Should I get another blood test? Because I really feel that something's not right. We're talking a lot of them.
Now, you said the tick was in for at least a day.
Yes.
Okay. I mean, at a day, it's not a slam dunk. I think there's roughly about 1/4 chance it was it. I mean, it couldn't hurt to repeat the test, but one of the things I would trust the test. I would still trust the test. What are you talking about? Joint pain or?
Oh yeah, I have joint
Yeah.
pain. I have, I get tingling. I get numbness. Just
I mean, for joint pain, I would really trust the test because the test is far more reliable in that Lyme situation. So, you had a question?
Yes, I'm not sure I'm clear. Is there a cure for Lyme disease?
Yes.
Okay,
The antibiotics work very well.
but they just take a long time.
Yeah, well, you got, by long time, I'm talking 2 to 4 weeks.
Oh.
I'm not talking super long time. I'm talking
I thought
2
you
to
were
4
talking
weeks.
years.
Okay. For pneumonia, actually 5 days of an antibiotic works. For strep throat, 10 days. This one is 14 to 28 days. Because
For it to work.
you're dealing with the half-life. See, antibiotics work at a certain stage in the replication of bacteria. The bacteria takes 12 hours to divide. It may work best at the 6-hour mark. So you got to get a lot of 6-hour marks. So you got to give it. But I'm talking 14 to 28 days, not a super long period of time.
And it should be cured.
And there is no resistance in Lyme disease. It's a simple bacteria. And in fact, Lyme disease, it's kind of interesting, shows a similar reaction to what you see with syphilis. It is so sensitive to the antibiotics that sometimes if you have a severe infection, you kill the bacteria so fast that the bacteria release their toxins in the system and the person gets sick because the bacteria are dying too fast. They call it a Yari-Schurzheimer's reaction. You see it in syphilis, you see it in just to demonstrate how sensitive this is. The antibiotics work well. Now you kill it. Okay, now what's the reality is? To me it's like putting out a fire. The antibiotics put out the fire. If you have joint pain, the antibiotics stop the process. Do the joints still hurt? Yeah, they do. Does pouring more water on the fire get it out anymore? No, it's out. Okay, you've killed the bacteria, you've got it out of you, okay, deal with what's left. But what you don't do is give them 2.5 years of IV antibiotics at the cost of $800 a day. You don't do that. That's what I object to. Yeah?
Not all ticks carry Lyme disease, though, is that right?
No, not all ticks. And in different parts of the country, I'm talking about the tick that carries it in this part of the country. In different parts in Europe, a different tick carries it, but not all ticks have it. I don't recommend you catch the tick and analyze the tick. I'm not treating ticks. I'm not treating arthropods. I'm treating humans. You know, yeah, they bring in a tick and, oh, I don't know. So, yes?
So are we assuming that if you have a tick on you for more than a day, that it does have Lyme disease? Curious.
There's a good chance it could have Lyme disease, and I get the prophylaxis. The prophylaxis is simple, 2 capsules. I mean, 2 capsules is the same thing that kids take for months at a time for acne. You can take 2 capsules for this for Lyme disease. Okay, thank you. I'll stick around. I know.